In this lesson, we look at allergic reactions and organ transplants. What is an allergy? An allergy is a hypersensitive reaction to an antigen by the body. Or another way of putting it, an allergy is a drastic reaction of the body seen in some people towards certain foreign substances or antigens that are normally harmless to the rest of the population. So the body responds to the presence of certain foreign antigens. These antigens may be present in otherwise ordinary substances like pollen grains, certain foods, dust, fur, and so on. So the body responds drastically by overproducing antibodies. So during an allergic reaction, the white blood cell, the lymphocytes that produces antibodies, overproduces antibodies against these otherwise harmless antigens. These antigens that bring about allergic reactions are also known as allergens. So allergens may be found in pollen grains, may be found in some drugs, and so on. So here is the white blood cell. It responds by overproducing antibodies. Now, some of these antibodies remain and adhere onto the white blood cells and also other cells. See, when antibodies are produced, they are released into the plasma where they react with the antigens or antigen-bearing cells. But if they are overproduced, some will remain adhering onto the surface of the white blood cell and other body cells. The result is that the antibody-antigen reactions occurs on the surfaces of the cells, with the result that these cells burst, releasing histamine. Histamine is a chemical substance that increases the permeability of the epithelial cells of the capillaries, thus making them to take in fluid and swell up. The intercellular spaces to become filled with fluid because the histamines will increase the rate of ultrafiltration. So the swelling up of the tissue, the inflammation results in pain. Now, these reactions can occur anywhere, not just on the white blood cells, they can also occur on any other cells in the body, resulting in a number of manifestations or conditions of allergy. These allergic reactions or manifestations are many and vary depending on the persons. So they may include, for example, the reactions occur on the surface of the eye, inflammation of the eye, and reddening of the eye also. Can have stuffy or runny nose, itchy and sore throat. Parts of the body like the lips may get inflamed. The respiratory tract may also get swollen and constricted, leading to asthma, where you have difficulty in breathing as a result of an allergic reaction. So the walls swell and the lumen of the respiratory tract becomes narrower, making breathing quite difficult. There may be development of skin rashes. The eustachian tube, the hollow tube that connects the middle ear to the pharynx, may also get blocked, and this impairs hearing and may actually lead to infections of the middle ear. Cavities in the head, the sinuses may become swollen, and this makes breathing difficult, and the swelling may produce headache. So different people have different allergens that cause their allergic reactions. For some people, it may be certain drugs like penicillin, aspirin, that may cause rashes. Or others may be types of food or certain proteins like groundnuts, eggs, that may cause the itching, sneezing, or even vomiting. In others, dust particles irritate the respiratory tract, bringing about an asthmatic attack. Now, under severe condition, the histamines may cause too much swelling in the body. That is, the histamine may increase the permeability of the epithelial cells to the extent that the blood pressure may drop. Now, lower than normal blood pressure is dangerous and may lead to what is known as anaphylaxis. Anaphylaxis attack when there is severe drop in the blood pressure. Now, this is how bee stings can cause death in some people. The bee sting contains allergens that increases the permeability of the epithelial cells. A lot of filtration takes place from the blood into the tissue fluid, resulting in swelling and, more importantly, a drop in the blood pressure. If there's severe drop in the blood pressure, this can cause death. So different people respond differently and to different extent to allergic substances, or that is the allergens. Now, one way of avoiding allergic attack is to avoid the allergens. Identify the allergens that cause the reactions, and that way you avoid the reactions. Or through the administration of antihistamine drugs such as Piriton to control the swelling. Then you also have organs transplants. Now, organ transplants has become increasingly important in that in many people, certain organs and tissue may become diseased or malfunctional and may be therefore necessary to replace them. Now, an important aspect of the animal body is that it's able to distinguish between its own cells and those from another individual, regardless of whether they are of the same species or different species. So, when carrying out organ or tissue transplant, it is important to ensure that the antigens present on the donor's organ or tissue will not be rejected by the recipient's body. Just like in blood transfusion, the cells of the organs or tissues to be transplanted have antigens, and these antigens may be identified as foreign and be rejected by the recipient's body. So that is normally one of the biggest challenges when it comes to organ transplants. Now, it's been possible to transplant a number of organs and tissues from one person to another, or even from an animal to a person. Some of the organs and tissues that are commonly transplanted include the eyes, or just the surface, the cornea, lungs, kidneys, pancreas, even skin. Bone, especially bone marrow, is transplanted, especially where we have a case of leukemia. Tendons, these are the ligaments that attach muscles to bones can also be transplanted, veins, portions of the intestines, liver, and of course heart and heart valves. These are organs and tissues that are commonly transplanted after ensuring that the recipient body will not reject the organ. Once that one is done, then the transplant can be carried out. Now, in case there is the urgent need to transplant an organ, even when there's a risk of rejection, then certain drugs can be administered to suppress the immune response of the recipient. These drugs suppress the rejection of the donated organ or tissue. In this way, the organ or tissue that is be transplanted can be kept alive, and thereby the patient will also be kept alive.